So have you ever said to yourself, I'm tired all the time, I've lost my motivation, I've got no libido, I just don't feel like myself anymore? Well, if that sounds familiar, there's a good chance that your symptoms are related to hormones. And one hormone that often can be missed in terms of getting checked is a woman's testosterone levels. Yes, testosterone, it's not just a male hormone. Women need this just as much as men need. In fact, testosterone is essential for female hormone health. It supports your energy, your libido, your mood, muscle tone, metabolism, and even your mental clarity. And again, when your levels are too low, everything can feel like it's just being shut down. So today I want to walk you through the key symptoms of low testosterone in women, why simply taking testosterone replacement isn't always the answer. In most cases, it's not. Some of the root causes behind low levels, like adrenal stress and high sex hormone binding globulin and hormone conversion issues. And lastly, how functional medicine approaches it and why it's very different than just writing a prescription for testosterone. First, what does low testosterone actually feel like? Some of those common symptoms in women are going to include low libido, a lack of sexual desire, chronic fatigue, sleeping issues that no amount of sleep can fix. It can be mood changes like depression or anxiety. It can be a muscle loss or increased difficulty maintaining strength. Certainly weight gain is an issue, especially around the midsection. Brain fog or poor mental focus, and just this general feeling of being flat or unmotivated. And if this sounds familiar, these things are often the symptoms that just get brushed off. And you might be told it's aging, it's stress, it's just part of being a mom, it's just, being busy. There's usually a deeper reason why your testosterone levels are low, and that brings us to the next critical piece. You can't just look at testosterone in isolation. All right, for a minute here, let's just talk about testing, right? In conventional medicine, you might get a basic hormone panel and maybe your doctor tells you, well, your testosterone levels are normal. But what they're really looking at is usually what's called your total testosterone levels, and that doesn't tell the whole story. What really matters, in part, in addition to your total testosterone level, is your free testosterone. This is the form of testosterone that your body can actually use. And one of the biggest blockers of free testosterone is a protein called sex hormone binding globulin. Sex hormone binding globulin is made by the liver, and really it acts like a sponge. It binds to hormones like estrogen and testosterone. And again, when sex hormone binding globulin levels are too high, it binds up too much of that testosterone, leaving very little available to your cells, even though your labs may look normal, and yet you still feel exhausted and you're disconnected and you're hormonally off. So if you've been told that your testosterone is fine, but you still feel terrible, ask for sex hormone binding globulin levels to be tested. And while we're at it, let's also look at another hormone called DHEA. So DHEA is made by your adrenal glands, and this is a precursor hormone to both testosterone and estrogen. So when you're under chronic stress, whether it be emotional, physical, or metabolic, your body is often going to divert its resources away from DHEA production and towards the production of cortisol, which is again your main stress hormone. Now this shift is part of what we refer to in functional medicine as the HPA axis dysfunction, sometimes called adrenal fatigue. You see, when your adrenals are overwhelmed, your DHEA levels drop, and as your DHEA levels drop, so does your testosterone and estrogen. And for women in their 30s and 40s and even 50s, especially those balancing work and family and life stress, this can lead to adrenal burnout, again, a major driving force behind low testosterone. And there's another sneaky factor at play here, which is the conversion of testosterone into something called DHT, or dihydrotestosterone. This is a more potent form of testosterone, and for some women, if you convert too much of your testosterone into this DHEA, you end up with acne, you end up with facial hair, you end up with thinning scalp hair, without getting the benefits of testosterone, like the energy, the mood, and the cardiovascular benefits. So again, this is why we don't want to just guess, we have to properly test, and testing is incredibly important. All right, so as I've mentioned before, in traditional medicine, your doctor sees low testosterone, they simply just prescribe testosterone. But let's take a look at how functional medicine approaches this, because it's, again, very different. Band-aid versus root cause. In conventional medicine, the answer to low testosterone is simple. Let's just give you testosterone cream or a patch. But in functional medicine, again, we ask, why is your testosterone low in the first place? We got to go upstream. We got to look at the adrenal function. Are your stress hormones robbing your body's sex hormones? DHEA levels. Is your body making enough of this precursor? We have to look at sex hormone binding globulin levels. Is too much testosterone being bound up by this protein? We have to look at thyroid functions because we know that low thyroid actually suppresses hormone production. We have to look at the liver because the liver regulates sex hormone binding globulin. We have to look at gut health. Yes, your microbiome plays a role in hormonal clearance and nutrient status, and that's because key vitamins and minerals are needed to support your hormones. So instead of just slapping a hormone on top of a system that's not working, we need to rebuild the system from the ground up. We support the adrenals, we address stress, we balance the thyroid, we optimize blood sugar, we improve liver function, we nourish the gut, we bring the whole endocrine system back into balance. This is what fixing the root cause actually looks like. All right, so just as a quick recap, couple things. Low testosterone in women can cause fatigue and cause low libido, cause cardiovascular disease, brain fog, muscle loss, mood swings, and so much more. And rarely is it a standalone issue. It's often a reflection of imbalances, really not in just one system, but many systems throughout the body. And while testosterone therapy may be appropriate for some women, there's often a much better first step. Find out why your body is making or using testosterone improperly. That's what functional medicine is all about. So if you're feeling off, low, or hormonally imbalanced, don't settle for generic answers or surface level testing. You deserve a deeper, more personalized look, and you deserve to feel and look like yourself again.